So this is welcome. This is our emergency room design by me, Celine, and Zoe. So our company introduction will be done by Zoe.
So we here at Zach have made a top of the time design to help patients and hospital staff. Um, we care about people and we want to help them as much as possible. So we created a new hospital to make sure they get as much help as possible and as soon as possible. I'm gonna hand it off to Angela for the emergency room layout.
So the emergency room layout, it's pretty simple. So the first floor is all public, while the second room is all staff related, personnel stuff things. So the first floor will include the actual waiting room, the receptionist, the pharmacy, the cafeteria, all the patient rooms, the OR, the radiology room, the ambulance bay. That's basically for everybody. That's like public space. The second floor is where we get to the staff break room, the staff cafeteria or kitchen. So the staff counseling room, the personal area, their lockers and restrooms. See, that's the on the left of the screen. That's the physical paper layout, but I also have a video because I had built the whole hospital in Minecraft to sort of show off better in depth what it's going to look like, and the video is 4 minutes long, but I'll be skipping through it. So basically, it starts off with the beginning, and you walk right into the waiting room, into the cafeteria, and then if I skip forward, you get to the pharmacy. If I go even more forward, there's areas like the OR, see, as you can see here. There's radiology at some point, if it'll load, down this hall. So that's supposed to be an MRI machine, but it doesn't really look like one, but it's okay. And if I skip forward, you get into patient rooms, fire exits, because those are important. As you can see through the Minecraft, you can see the more details. You have more depth to see what the building's supposed to look like. So that's the ambulance bay. I can skip to the second floor. So here is like the counseling room for staff with an Italian theme. But that's basically the whole build. You can see the outside of the area too, so lockers. If I skip more forward, you have the outside looking pretty because you don't want your patients dying and the only thing they see is a highway, so you've got trees. And then our next issue is the innovation in patient care. So complaint and patients, and Celine's going to introduce our patients.
Yes, and I'm so excited too. So our first patient, we have Michael Helms. So just to give you a brief overview of what's going on. So with him, he's at the top of the list because he has the most severe triage level. So what happened with him? He's an on-duty cop who got shot in the left shoulder, and unfortunately there was no exit wounds. He has severe, blood loss, and he also had a complaint of tingling in the arm. And then we have Priyagosh, the second level of triage level patient, and what happened with her was while on the way to work, she was, unfortunately hit by a car, and because of that, she has trouble moving her legs, and she cannot twist to the waist because of excruciating pain. And then lastly, we have Doris Dingman, and Doris Dingman, she unfortunately slipped while she was showering, and she's unable to put pressure on her right leg, and she also has complaints of her wrist pain. And now
So our first,
Angela's going to introduce you to them.
so our first issue here is the congested hallways, which just means that people can't get around because sometimes in some hospitals we have patients out in the hallways being left in their gurneys, which take up space. So our issue for this is having sort of an open hall area where you, instead of leaving your patients out in the gurneys in the hallway, you leave them out in that open area. So you have so you have space to move around where you're supposed to be walking, and the patients have their own area where their family can see them, where they can be treated without taking up that hallway space. And Celine will talk about how that's helpful for our patients.
Okay, so congested hallways. So obviously there's a lot of, claustrophobic issues because there's so many people in one space and there's so much equipment. And so we created this innovation with open space rooms, specifically to have these rooms unoccupied for any emergency, seating, and for any emergency patients that we need to be, that need to be tended and need to have the recovery that they need. And this is used when ever the hallways get severely packed or the rooms get severely packed, and with these patients, specifically Michael Helms, he's going to be able to get his treatment, get the surgery he needs to remove that bullet wound, and he's going to be in this open space rooms to be comfortably rested, as well as the other patients as well.
So our next issue is the limited ability to track patients as they move around within the hospital. So sometimes patients, obviously they want to get up and walk around because, they're tired of being stuck in one area. They're tired of being in the room with like the white walls, white depressing walls, decide to get up and walk. So what we decided we would do is in those patient wristbands that, patients will get in every hospital when they're admitted, is how the barcode that has all their patient information. So that's basically going to work as a tracking device too. So before they enter, they walk through a specific door. The door won't open without having to scan that. And basically, what that's going to do is it's going to send a last known location to their patient file. So in case if a nurse needs to find them because they're not in their room, the nurse can just look at their file and basically see where they were and then head to that area to find them around the place. If not, they will also get an update of where they were last seen too. And so Celine will talk about how that's helpful to our patients.
So going into how this specific innovation is going to be helpful to our patients. So of course, during their time of recovery, during their time of stay in this hospital, no patient is going to want to stay in one room. They're going to want to, move out eventually because they don't want to be, just kept isolated. So they're going to probably want to go out in the, the courtyard. They're going to go out in the cafeteria to get, food themselves rather than it being taken to them. So this tracking system is going to ensure that none of them are lost and that it doesn't, cause any confusion with the doctors or nurses looking for these patients. But so yeah, with the wristband, with their information, whenever they enter any door leading to a cafeteria, even the bathroom, this is going to ensure that all the doctors know wherever these patients are at all times. And yeah, it's just gonna provide efficiency in tracking patients overall.
Our third issue is tedious moving of heavy and bulky equipment from a room. So sometimes there's no way to condense down bulky equipment because it needs all of its electrical wiring and stuff like that. So instead what we did is in our hallways, we have sort of two lanes. It'll be like a street. So we have an express lane and then the regular walking lane. The express lane is meant for emergencies. So in case the patient needs to be seen quickly or needs to be admitted to a room quickly, they can go through the express lane. Or in case of a need for, bulky equipment from place to place, but you can't really quite get through because everybody's in the way there, everybody's walking the hallway, you have that express lane so you can specifically, take the equipment to specific rooms through there with avoiding, being blocked by, staff or random patients walking around.
Yeah, so kind of relating how this innovation helps our patient care and improve it. So, all three of them, Michael Helms shot in the arm. Priya Ghosh, she can't move or walk at all. And then Doris, she also has trouble with walking. So specifically relating it to Priya and Doris. So when they have their time of recovery, they can also use this express lane whenever the hallways will also be congested. Hallways are, blocked, but, this one addressing specifically the complaint of tedious movement of heavy equipment. So not just equipment. So because during their recovery, they're going to want to have, doctors are going to have to bring their food to them, specifically nurses. This is going to ensure that everything is efficient and that there's no trouble with anything being taken from room to room, specifically with them and how they need their treatment and even ID and other treatments to check that their vitals are okay. This emergency express lane is going to ensure that the transfer of supplies is efficient.
So our next slide for staffing issues goes to Zoe.
So there are two issues we want to focus on. One of them is mental health. Many medical staff suffer from low mental health, such as depression, anxiety, PTSD, from going through difficult decisions and situations every day because it's their job in the emergency room to go through those type of things. Another thing is being short-staffed. Many hospitals are very low staffed and that they need more nurses and doctors. Because of the low staffing, this causes for patients to pile up, and this also causes for uh, the medical staff to have burnout and to be more at risk for mental health issues such as depression, anxiety. For the solution for these, we have two solutions for the mental health. For mental health, we can have mandatory breaks for the staff. This allows them to take a well-deserved break away from patients in an area where they can eat food and relax and actually have a break from taking care of people. And they could also have their own personal therapist, which will allow them to have someone to vent and rant to about very hard, difficult decisions. It allows them to get the help they need. For low staffing, our bill we have made, which will be presented in the next slide, um, it will it will offer more tuition for incoming nurses. The medical programs will offer students to rather become residency teachers, and this will allow doctors. Well, this will allow for lower responsibility on the doctors and nurses, and allow for more help to be done at the hospital to help more people. On to our next slide to Celine for the impact of the bill.
So, okay, introducing our in so like Zoe mentioned before about our bill. So our bill 1317 or Mina of 2024. So overall, this bill is what makes it possible for us to even have this emergency room. And the specific impact that it has is that it's going to bring in more doctors into the hospitals and take on the roles of making sure that the efficiency of the hospital is at its 100% best. And this is going to be done by providing more affordable tuition, more affordable schooling to these individuals that want to pursue these careers in the medical field, specifically work in the hospitals. And this is obviously going to ensure that they have learning along the way, and that they gather and get the skills that they need in order to run a well functioning emergency room overall.
So that's everything. So, thank you for listening. If you guys have any questions, you guys can email us or call us at our phone number here. That's our website. And yeah. And then Screencastify stopped working.
Did you record everything?
Do you think we need another take?
Well, I'm about to find out right now.